exercise therapy topics in a practical demonstration view, which will be useful for our students and also the outsiders. So today I am here to explain you about the introduction to the anatomical movements of the body. Myself, Dr. P. Anupreeti, working as Assistant Professor in the Department of Orthopedics, Faculty of Physiotherapy, Dr.M.G.R. Educational and Research Institute, deemed to be University. As I said, today we are going to see introduction to the anatomical movements of the body. First, we have to know the definition of the anatomical movements. So first we have to see the definition of anatomical movements. So anatomical movements can be defined as act or instant of moving a body structure or as the change of position in one or more of the joints of the body. It is nothing but the joint produces various movements. So that movement we call it as anatomical movements. And before we are going to see the anatomical movements of the joint, we should know the body position. So first we'll see the positions of the body. Joint movement or joint action can be described in the anatomical position, which we call it as universal starting position. So before entering into to learn the movements, first we have to know the basic anatomical positions. So the body is divided into two halves. So we call the center part as the medial and the lateral part. The part which is away from the medial, you call it as lateral side. So we say it is the anterior surface, and the back side of your body is called as posterior surface. And then the upper part of the body we call it as superior position, and the lower part we call it as inferior position. Then we have proximal position and the distal position. The joint which starts at first, or it starts at the upper part, we call it as proximal, and which ends at the lower part, we call it as distal. So next thing, before entering into the movements, we have to know about the axis and planes. So if we know clearly about what are the axes and what are the planes playing in your body, we can easily demonstrate the different movements of the joints. So first, a plane is an imaginary flat surface running through the body. So it is a flat imaginary surface. So imagine a surface which cuts the body from the frontal suture and from the sagittal suture and from the transverse plane. Now I'll explain one by one. Frontal plane is otherwise called as coronal plane. So where it cuts the coronal plane into two halves, so we call this as a frontal plane. And sagittal, where the sagittal suture is cut into two halves, we say sagittal plane or antero-posterior plane, that is AP plane. And the transverse plane are called as horizontal plane, which divides the body into two halves, the upper part and the lower part. Now talking about axis, an axis is an imaginary line at right angle to the plane about which the body rotates or spins. So to clearly know about how the axis works in a body, so we have a plane here, and the axis is nothing but where the line passes at right angles to the plane, we call it as an axis. So we have three axes. The first one is sagittal axis or the AP axis, and the second is frontal axis or coronal axis, and the third one is vertical axis. So now we'll see with the plane and axis how the movement takes place, and in which plane and which axis the particular movement takes place. So when you have a frontal plane or a coronal plane, the movement occurs in this plane is a sagittal axis or a AP axis movement. So we can say, for example, body abduction and body adduction takes place in frontal plane. Second, in sagittal plane or the AP plane, the axis takes place at frontal axis or the coronal axis. Here the movement we can explain or give example as flexion and extension movements. Then in transverse plane or horizontal plane, the axis takes place is vertical axis. Here the rotational movements takes place. So for example, internal rotation, external rotation, and like circumduction, all this movement takes place in your transverse plane and in the vertical axis. So with this brief explanation, we'll start with the practical demonstration of the anatomical movements of the neck. So in neck we have flexion, extension, right lateral flexion and left lateral flexion, right rotation and left rotation movements. Now the model will demonstrate. So now I'll explain the model to how to demonstrate the neck anatomical movements. First, the model has to be in a neutral position. Neck should be in a neutral position. Now bend your neck forward and touch your sternum. So this movement we call it as neck flexion. Go to neutral and then bend your neck opposite side. So this is extension of your neck movement. Come to neutral, turn towards this side. Now the next movement is lateral flexion. So we have two sides. One is right lateral flexion. Come to neutral position, and the other one is left lateral flexion. Come to neutral position. Next movement is rotation. So right side rotation, your chin has to come to your shoulder. Neutral. Left side rotation, come to neutral. So this is what the anatomical movements of your neck. So next we are going to see the anatomical movements of the shoulder joint. Today we will cover the upper limb joint movements. So first joint is the shoulder joint. So in shoulder joint we have all the combination of movements. So flexion, extension, abduction, adduction, internal rotation or medial rotation, external rotation or lateral rotation, circumduction and scaption. So now first we will see the flexion of the shoulder joint. Bring your hand forward, take to 180 degree, bring to the neutral position. So this is flexion of the shoulder joint. Now take your hand backwards without flexing your elbow and come to the neutral position. So this is extension of your shoulder joint. Turn towards this side. And now the model will do abduction of the shoulder joint. So 90 and 180 degree abduction, bring to 90, neutral. This is called adduction of your shoulder joint. Now the model will do horizontal abduction. Take your hand forward to 90 degree and then take to the horizontal side. So this is called horizontal abduction. Come to neutral position. Now the next movement, internal or medial rotation. So now the model has to keep the shoulder in 90 degree and bend your elbow. So all the 3 points should be in equal line: shoulder, elbow and wrist. Now the model has to bring the hand down. So this is internal or medial rotation. Come to neutral. Now take the hand upward. So this is external rotation. Come to neutral. Neutral. Flexion, extension, abduction, adduction, internal and external rotation. All the 6 movements combine to do a movement called as circumduction. So we have clockwise circumduction and an anti-clockwise circumduction. So first bring to flexion position, then take backwards and come to adduction. So clockwise rotation, backwards, bring towards front. This is anti-clockwise circumduction. So next movement is scaption. The model has to keep his hand in a mild abducted position with the thumb facing upwards. Now you can bring upward enough, you can bring downwards. So this you call it as caption of the shoulder joint. So next we are going to see the scapular movements. First movement is elevation and depression. So the scapula has to be elevated. So you can bring your shoulder upwards to the maximum. Now you can feel the scapula is elevated, which means it goes upwards, and come to neutral, bring downwards. Now your scapula goes to the downward position. Next movement in the scapular region is retraction and protraction. So retraction is nothing but both the scapula has to come together. Okay, so bring both the scapula together, come to neutral position. Now protraction, so both the scapulas away, come to neutral. Next, upward rotation and downward rotation. So upward rotation is nothing but we have to ask the model to have a box in the hand and keep it in the shelf at the higher position. So you can imagine you have a box in the hand, you can keep it in the higher shelf. So with this position, the scapula will go to upward rotation. Now bring the box and keep at the lower shelf. So this is your downward rotation of your scapula. So next joint is elbow joint. In elbow joint we have two movements, one is flexion and the other one is extension. You can fist your fingers. Now bring your hand towards the shoulder. So this is flexion of your elbow joint. Now bring to the neutral position. Neutral. This is extension of your elbow joint. Next movement is supination and pronation, where this movement takes place in the radio-ulnar joint. So flex your elbow to mid position. Now with this position you can turn your hand this side. So this is pronation and turn towards this side. So this is supination. Next we will see about the wrist joint anatomical movements. So patient hand should be in mild flexion position of your elbow. Now the patient should bring the hand towards the ground, which is called as flexion of the wrist joint. Come to neutral and take towards upper side. So this is extension of your wrist joint. Keep in neutral. So the next movement is radial deviation and ulnar deviation. So now the wrist, your thumb has to come towards your radial bone. So this is radial deviation, come to neutral. Your little finger has to go towards your ulna. So this is ulnar deviation. The next movement is hand movements. Now we'll see the thumb movements. First movement is flexion of your thumb and extend, come to neutral, extension of your thumb. Do thumb. Now we'll see the anatomical movements of your hand. First thumb movement, thumb flexion, neutral, extension, come to neutral, thumb adduction, thumb abduction, nalla. Opposition, thumb opposition, bring to neutral, we call it as reposition. So now all the four finger flexion, extension, now turn towards backward, do abduction of your fingers and adduction,